list has stopped growing so quickly, so I'm going to get us kicked off. Hi, everybody. Thank you so much for joining us tonight. We're excited to be able to share all of this good information with you. My name is Lindley Espeseth, and I'm the Communications Manager for the Office of Early Childhood. I'll be kind of running the back end of the Zoom call this evening. A few notes before we kick ourselves off. We are recording this webinar and we'll distribute after. Please feel free to share this with anyone else on your teams, partners, folks that you'd like to have this information. We will be taking time to take questions at the end of the presentation. If you'd like to type your question at that time during the Q&A, feel free to put it in the chat or the question and answer box. If you'd like to ask your question out loud, please raise your hand and I will unmute you so you're able to ask your question out loud. We're going to try and keep the first 15 minutes of the question and answer period really as general as possible. So kind of those broader general questions you might have about the program, application process, that kind of thing. After we hit the 5 o'clock mark, we can definitely take questions that start to get a little bit more specific about, specific providers or scenarios that you might be seeing. We'll do our best to answer those. We do want to get as many general questions answered as possible. So if for some reason we can't get to all of those kind of really specific program questions, my colleagues are going to drop a link in the chat to the help desk link that we have, and that's a really good place to send those specific questions because you'll be able to get kind of individualized support for those specific topics you might want to ask a question about. Same thing for some of those broader general questions. We are working on preparing a question and answer document. So if we don't get to all of the big, broad general questions during the Q&A portion tonight, we'll make sure that that gets added into that document and we'll be sure to send that to you as soon as that question and answer doc is live. Just a note that we might not have answers to all of your questions yet, but we'll definitely work with you as quickly as possible. If you're having any challenges, we have both our Office of Early Childhood team, as well as the MetrixIQ team here for TA, for you, and for childcare providers. So we'll do everything we can to get any issues addressed as quickly as possible. We have some specific resources for providers, and we would definitely encourage you to share this with them. My colleagues will be dropping some links into the chat this evening, so be sure to pass those on to providers. They're a great resource to help them. We're also going to have provider-specific information sessions in both English and Spanish, and we'll drop in the links to those as well so folks can get signed up for those. So with that, I'm going to pass it over to Mary Alice.
Great, thank you, Lindley. Hello, everyone. My name is Mary Alice Cohen, and I'm the director at the Office of Early Childhood. And thank you for being with us tonight, this afternoon, almost tonight, as we explore our grant, our stabilization grant partner technical assistance webinar. We're so relieved and thrilled to be at this stage. As you all know, the application goes live tomorrow, and you have all played such an important role in helping us with all of the stimulus strategies, but really in this last stage, helping us with the feedback on the application and how to roll all of this out. And we're just so grateful to each of you for your partnership. Together, we can really support our early childhood providers as we move into this next stage. So as you're supporting our early childhood professionals with the completion of the application, please know that we are all here to support you, as well as our valuable partner Metrix. So we're all ready and standing by. On the call today, I just wanted to share with you that we have members of our OEC team from licensing and from CCAP and from communications and finance and operations, policy and quality improvement. So we have great representation from our entire OEC team to help answer any questions that you may have at the end. So again, thank you for all you do to support our early childhood professionals. We can't do any of this without you and being side by side with you throughout the process. So now I'm pleased to introduce you to our vendor partner, MetrixIQ, and I'll turn it over to Paige to introduce you to the Metrix team.
Hi, everyone. Thanks for joining. Really great to be able to provide all of this information for you as we get ready for the application launch tomorrow. My name is Paige Morandi. I'm a director at MetrixIQ. A couple of my other colleagues are here as well. I'd like Lexi to introduce herself, as she'll be managing and overseeing the grant program on our side.
Hi, everybody. Thanks for being a part of this meeting. It was really nice to kind of meet everyone since I'm new. This is day 3 for me. My name is Lexi Tebow. I actually just met with my own team today for the first time. So we're all really excited to kind of roll this out for everybody because everybody's just done an amazing job, a lot of hard work. So we're very excited.
And then a little bit later, my colleague Megan will walk you through the application as well after I give a little bit of an overview next. You can go to the next slide, Megan. So this grant program is a non-competitive grant. It's open to all child care providers in Colorado that are licensed or qualified exempt, meaning that they are providing services to CCAP students. If they'll receive the payment amount over 9 equal monthly payments, and that amount will be based on their licensed capacity and Colorado Shines rating level. There is a resource in the provider resource folder that has that chart of what the amounts would be. The application will open up tomorrow, and then we'll accept them on a rolling basis through September of this year. The sooner a provider is able to apply, the sooner they'll start their 9 months of payments. The application tomorrow is going to be a link emailed to them to the primary contact on file through their license. And that will come directly from the Metrix team from our email, which is coecstimulus@metrixiq.com. That's available in other places as well, and someone can drop it into the chat. In that email, they'll have a link that they'll click and go to complete the application that will ask for some basic information about their program and their open and operating status, their banking information and their tax information, and then also have them attest to the ways that they will use the funds. Megan will walk through each step of that application in a moment here, so you can know what that will look like for providers. So to be eligible, like I mentioned, it's a non-competitive grant program. They just must be open and operating currently, meaning that they are currently open to serve families. And they also had to be in operation as of March 11th, 2021. Allowable uses for the grant funds, there's several categories. There's a document in the provider resource that we can drop in the chat here for your reference that outlines all of the allowable uses. There's 2 different grants that will be distributed over these 9 months. The first is the Operation Stabilization Grant, and then the second is the Workforce Sustainability Grant. So they have slightly different uses. As you can imagine, the Workforce Sustainability Grant is for compensation, staff benefits, employee resources, professional development, and focusing on workforce retention. The stabilization grant is more for operations expenses, either existing or new, including personnel costs, facility costs, that could be rent, mortgage, health and sanitation expenses, equipment, goods and services such as food service, educational materials, supplies, wraparound services for students such as mental health and counseling, and then reimbursement of costs that were associated with pandemic costs over the last couple of years. And then for more information on those and to have those written, again, refer to that document in the drive. Following the provider's initial application, once they're approved and they're in the funding queue, to continue receiving their 8 other payments, they'll have to do a monthly attestation process to confirm that they're still agreeing to use the funds in the way and the allowable ways, that they're still in operation, and also helping us understand how the funds are impacting their operation. As we get to those steps in the process, we'll be sure to communicate and have more resources available up front, so providers know what to expect for each month and the type of questions they'll have to ask. We're still working on that piece, but again, we'll be sure to fully communicate it with providers and you all as resources are available and more information for those pieces. I will pass it along to Megan and we can walk through the application.
Hi, everyone. My name is Megan Helseth. I'm a program manager at MetrixIQ, just helping with the implementation here of the application and all of its sort of associated pieces. So I'm actually going to stop this share and reshare a couple of documents on a different screen, just so that you guys can see really a good example of what this experience will be like for our providers. So first, I just want to show you what the email is actually going to look like that they're going to receive tomorrow. So you'll see that the email is coming from MetrixIQ, COEC stimulus at MetrixIQ.com, just like Paige was mentioning. And then what we've done is we've made sure that information about the provider is actually in the body of the email. This is to really ensure that they've received the correct application and they can make sure that they're filling out the right application. So this should be customized. You'll see this is my name here and, a fake address. So this is just so that they can really be aware that they are filling out the correct survey. So you'll see they have 2 options here. There's the link, follow this link to apply. You can click take the survey, or they can copy and paste this link that's below that in the email into any browser and it should work. Now, this is a personalized link that's based on each and every license number and each location. So every single provider will receive a unique link that they are going to fill out for their specific location. So the link does not expire. You can pass this link around to other people to fill it out. If you close the survey halfway and you need to re-enter it, you can continue to use the same link. So we're really trying to make it as easy as possible and make sure that they can really just keep returning to that same link. And anyone who's associated with that provider can fill it out. So it does not have to be the person who it was emailed to. I'm trying to think if there's anything else. I mean, it will save your progress. You can forward the link. And I think the other thing too here is that we're communicating to them that they will receive a response from us within 15 business days of submitting the application. Now, obviously, those people who are submitting their application on Friday and next Friday, 1/28 for the expedited first grant award, those folks would need to still submit by 1/28. But if in the future, we're going to be doing this on a rolling basis. So people can apply at any point between now and September 30th. And this link will continue to work. So if they choose not to apply until later in the summer or the fall, they can still use this link to complete their first application. All right, so now I'm going to stop the share on my email so you guys don't have to look at that, and I'll pull up the survey. Excuse me, the application. If I can find the right window, I apologize. Here we go. Okay. So when the providers open the application, they'll first be given a page with some general information about the grant program, including just some brief introduction to what the grant program is and how it works. We also have just some additional information here where we're really recommending, and this is something I would really like to stress to the partners who are going to be helping providers through this application. The easiest and fastest way for these providers to complete this application will be to have a copy of their W-9 form completed either by someone in their organization or by their accountant. It's really important just because I know not everyone is really familiar with their tax classification and things like that, but it's very important for us to collect accurate and good tax information for these providers. So just want to emphasize that if they have that completed W-9 form to work off of, this application should be really, really simple and really easy for them. If they don't have that W-9 information, then it may take a little more time as they collect those pieces of information. But if you could encourage all the providers to really keep that document handy as they're completing it, I think another piece of useful information would be their ACH and banking information. If they just have that handy and accessible, that'll make all of the financial pieces of this application go super smoothly. So something that Paige had mentioned is that we are actually trying to make this even easier for folks by importing the information for them. So like I said, this is a personalized application for each person. You'll see here that this top section matches the information that was in the email that I received. So in this first section, we are really just asking all the providers to confirm any of the information that's been piped in that's in this yellow highlight. And really, they just need to mark here in these columns, yes or no, is the information correct? Now, what I'll say here for this audience is, if there's any information that's incorrect in this section, it is likely that their application will get flagged for review by the CDHS licensing team. That's because the information that's being piped in here is connected to their license number. And so it's very important for us that we have this information correct. So if this information is wrong, the provider should just know that that will mean that their application is going through a review. If all of this information is correct and they complete the application and fill everything out, then they should receive a very quick acceptance into the program. But this is where the pause would come, is if they have any incorrect information in this section. So I'm just going to go ahead and fill out yes here. The other thing that I think that you guys would just want to know is that for some, but not all of these options, if I do say that this is no, they'll get an opportunity to correct this information later in the application. All right, and now on the operations question, I just want to spend a quick second speaking about these eligibility questions, which you can see here down these statements that they need to affirm to. Again, this is going back to the eligibility requirement that Paige mentioned. The provider must have been open and in operation as a child care provider on March 11th, 2021. If they were temporarily closed for COVID, that's okay, but we do need to know that they were operational as a child care center on that date. If they were not, this is the only statement that will create an automatic denial to the program, because it's our only automatic eligibility requirement. We can come back to this if you guys want to talk about it more in the Q&A. But the other thing is that they need to be open and operational now. And now what now means is obviously a little bit different. It's really depending on when they are submitting the application. We want them to be open and operational. So if they've been closed for a few months and they're planning on reopening, they should complete this application no more than 30 days before their planned reopen date, if that makes sense. So again, we're just going to confirm that this information is correct. I do have some notes here about what open and operating and temporary means. So hopefully this answers most questions about who qualifies. We'll say we're not temporarily closed. Now, the same deal on this page. We're just really reconfirming that the information that we have on file for your director is correct. This may be blank for some providers. They can go ahead and click no, and they'll be given an opportunity to enter that information on the next screen. I'm going to say it's correct because I do have it all filled out. Then we're just asking a couple of data collection questions about the site director. So these are just some race and ethnicity and gender questions. This is specifically for multi-sites, and I think we're going to want to talk a little more about multi-sites maybe separately at the end. So I'm just going to say no, that I have a single location at this point. Here is where we're asking them if there's someone that they would rather have receive the application, someone different than their site director, if they would like to have a primary contact for this application process, for the grant process, for all of the reporting, they would enter that person's information here. If they want us to contact someone specifically about their W-9 information, their tax information, any of their bank account information, they can enter a finance person here. Okay, and then this section is pretty simple. We are asking a couple of data collection questions. Now, in this section, all I really want to emphasize for this audience is that this is a non-competitive grant. So all of the questions that they complete in all of this application have no effect on the amount of the grant that they are going to receive. That amount award has been pre-calculated. These questions are for data collection purposes only. So I hope providers don't come to you worried about these questions in this section, because it's really not going to affect anything about their grant. It's really just for us to understand how the pandemic has impacted childcare providers in the state. So I'll go ahead and choose a couple of answers there. Now, this is the first page where you'll see that we've got the grant application amount, or excuse me, the grant award amount pre-filled here again. So like I said, this number is pre-calculated. It is based on their enrollment and their Colorado Shines quality rating. So this number has been predetermined, so they can see here the total grant amount, and this is just for the Child Care Operations Stabilization. So this is just for operations. They will receive $950 per month, approximately $8,500 total over the 9 months. When we scroll down, we're just asking for some information here. And again, this is not going to affect the amount or of the award that they're receiving. But when we scroll down, we're just asking them to give us an idea of how they're planning to use these funds. And there's obviously a lot of categories here. There's a lot of different things that they can use this money on. It's really quite open-ended. So we just ask them to check any and all that apply. Oh, it's making me choose one. Now, this is the same situation, but this is just for the Workforce Sustainability Grant. So what I would just note for you guys here is that their total monthly award is going to be a combination of both of these grants. So the $850 per month we saw in the previous page, plus the $234 that we see on this page will be their total monthly award. But you'll see they also have their total workforce award here, which is the $2,000. So we're just really breaking it down for them in a couple of different ways. And they should receive, when they are accepted to the program, they will receive an email from Metrix that gives their total monthly award. So they'll be able to see those numbers combined. So then again, we scroll down and we just ask them to give us a little bit of information about how they're planning to spend these funds. And again, we have a ton of options here. This is really open-ended, but as Paige was saying, this grant is really particularly for workforce and payroll costs and related expenses. And the operations is really for location operational costs. So I'll choose a few here. Now we enter the banking section. So like I said, if they have a completed a completed ACH form, this should be quite easy. They will just complete their name, their bank name. This is going to change a little bit before tomorrow, but they just enter the bank account type. Let's give a random account number and a routing number. Now we ask them to just confirm this information below. So I'll just copy and paste. It will stop them if this information is not the same. So this is really quite simple. I mean, this is just like any kind of ACH form, but obviously if you guys have any questions, feel free to drop them in the Q&A and we can answer those at the end. Now, this is the section, and this is the last section of the application, except for the attestation. So it's going to be pretty important that they get this W-9 form alongside them so that they can complete this section easily. But essentially what they're doing is they're just following right along with their completed W-9 form. So all of these boxes will just correspond with the paper form. So we'll complete my name. I don't have a business entity name. We ask if the address for tax purposes is the same as the physical address we have on record. We'll say for this case, yes. If it's not, they will have an option to add in the address for financial purposes. Then they're asked to choose a federal tax classification category. And again, this is very important that they get this correct and that this classification is correct because it's going to affect how they're going to be taxed for this grant money. So as long as they're following a completed W-9, this shouldn't be a worry, but certainly I know we've gotten a lot of questions about it, particularly how nonprofit organizations will be able to enter their tax information. And those folks just need to make sure to choose other, and they'll be prompted to give the correct information for their nonprofit status. For now, we'll just choose individual. Then we're asked to enter a social security or employment identification number. Again, they just need to know which is which and which one they need to have on file. So I'll add in a number here and I'll say it's a social security number. And this is the very last section of the application. And really all this is a list of statements that they need to agree to in order to complete the application. So this is a standard release on the W-9 form. So this is just the exact same as it would be on an IRS form. This list of attestations, I certainly recommend that they read very carefully. There are quite a few of them, but really these are general grant program statements that they need to agree to. Like I said, they need to agree to these in order to be accepted into the program. So we will check all of these. We do need to release information about the program, so they'll have to affirm to that. They give us the name of the authorized person. They give us the title. They affirm that a digital signature will work. And then they just type their name here, and that's going to constitute a digital signature. Once they click this next button, it will take them to the completed message in the system. So that is how they will complete. We will receive the application on our side, and we will begin our review, and they will get an email when the application has been accepted or is in progress. So I think I covered that in enough detail, but obviously if there are questions about that, we can return during the Q&A section. Just going to stop my share here and make sure that I have everything else queued up. Paige, did I miss anything? Do you want to jump in at all?
No, I think that's great. I see questions coming in. I know we've shared a lot of resources in the chat, and that's a ton of information available on the website as well. So I don't know if we want to just go ahead and open it up to answer questions.
Yep, I'm just looking at
more material you wanted to walk through before we start questions.
Yeah, why don't we just walk through a couple more things, and I think it'll be pretty quick. Yes, and then we can return to the questions. Okay, so let me share one more thing with you. So I know there's been just a little bit of conversation and maybe confusion about how and when folks are going to be getting paid for these first few groups. And so I just want to walk you through what a timeline is going to look like, including what those reporting requirements are going to be for them monthly. So I'm going to share, and this document is in the provider resources folder that Lindley has shared already, and I'm sure we'll share a couple more times in the chat. So this is available for all the providers to review in detail as well. Okay, so as you all know, the application is going to open tomorrow, January 21st. For providers who are extremely excited about this grant program, as we are, they have an option to complete their application before next Friday, January 28th. And this will put them in our first payment group. This will expedite their first payment. So they will receive if they complete their application and they are accepted into the program, they will receive their first payment on or about February 11th. So that first monthly payment will be on February 11th. Then they will actually receive their second payment on February 28th. So this is a little confusing because it's kind of got two groups in here, but their second payment will be on February 28th. Then their first monthly reporting requirement will be due on March 15th. So for the group that applies by January 28th, they are not doing any reporting at all until March 1st is when it will open, and it will be due March 15th. They need to complete this reporting requirement each month before the 15th in order to be paid on the last day of the month. Okay, I want to say this again, just because it can be a little confusing. Moving forward, as they are doing the reporting will always open the first of every month. Providers need to complete that reporting by the 15th of that month, and then they will be paid the last day of the month. That'll be the cadence moving forward. For this first group, they'll actually be receiving payment 1 and payment 2 before they do any of their monthly reporting. So getting in by that January 28th date is definitely going to be good if they would like a little bit of money before they have to worry about the reporting. But like I said, they can apply on a rolling basis. So anytime they apply, this cadence will start up again. So if they do not apply by January 28th, the next cutoff is going to be February 15th. So if they complete their application between January 28th and February 15th, they will still receive their first payment on February 28th. If they submit their application on February 16th, for example, if they miss it, they're not going to receive their first payment until March 31st. Again, I know this is a little weird, but I just want to be clear about it. Basically, the reporting for everyone starts March 1st. Some of these early groups are going to get some payments before their reporting starts, but that's the sort of important thing to know. Paige, did you want to add anything?
Yeah, I'll just add, so because it is a little complicated and there's so many monthly steps, each provider, once they're approved, their schedule will be set and they'll receive that along with their approval. So they'll have this and they'll know what their specific deadlines are and when their specific payments will be. They'll also, I saw a question in the chat, will they receive a reminder or a link? Yes, many. They will receive many communications from us through the full process.
Yes, we are definitely not expecting them to remember all these things. Like, we will definitely be sending them a lot of emails, and they will have an entire portal where they can go in to complete all of these required reporting. So that's going to be launched on March 1st. So definitely keep your eyes open for more information about how that's going to be handled. But for now, I think that's kind of the important piece. So okay, now I think the last thing that I was really going to share is a little bit of information about the resources that MetrixIQ has put together to support the providers as they are moving through this application process. We've really tried to be as thorough as possible to make sure that we have a lot of resources for them and they have a lot of opportunities to reach out for help, either with the application or any real questions they may have about the grant program itself. So let me share one last time here. So this is just a sort of broad graphic that's kind of giving a little bit of information about what their different resources are. So Lindley has already shared the provider resource packet. That's the Google Drive with these different forms inside of it. So for example, the application guide, the draft questions, the grant award tables, the payment schedule that I just showed you, and the document that's the allowable uses of funds. So this is really, I would say, the first line of defense here for questions. Like if they are just sort of basic informational questions about the grant program, I think this is the best place for providers to go to sort of start learning about the program and start getting a sense of how much their award amount could be. We also are hosting a series of webinars in the next couple of weeks and ongoing about the grant program, how the providers can apply, all the information, basically this exact presentation you all are seeing today, but just aimed for providers. So we're going to have plenty of webinars, plenty of opportunities for that. I believe they've already dropped the Calendly link to sign up for that in the chat, but we do have Spanish only and English opportunities for those webinars. They're coming up. If you guys think it would be useful, I'm happy to show that page and how to sign up. But I think if you are familiar with Calendly, you can just go to this link, calendly.com/COEC stimulus, and you'll be able to sign up for provider webinars there. Now, at the bottom in this box, this is really the different types of help and support that we're going to be able to offer here starting in the next few months. So these ones at the top are ones that are going to be live for the launch tomorrow and for this first week as we get through this first group of applications. The fastest and easiest and most reliable, definitely the best way to get in touch with us is to have the providers complete the ticket at help.coecstimulus.com. That help desk that Lindley was referring to earlier. This directs them right to the form where they can ask us a question, they can provide their information that we need in order to serve them as quickly as possible. And Lexi's team is getting up and running with our help desk so that they can provide super speedy and really great answers to all the providers. You can also have them email coecstimulus@MetrixIQ.com. And they can call this number starting tomorrow, please. This is not live yet, but starting tomorrow, they can also call this phone number. And all of these different resources will be connected to our help desk team. So they will be able to just route your information to the right person to make sure we can get all their questions answered. We also are going to have a few additional support systems here, like a live chat system. That'll go live on March 1st with our portal. So keep an eye out for those resources being added. They are not live yet, but they will be. Our help desk is going to be all connected to providers via their license number. So if they are calling or emailing for support, we really suggest that they provide us their license number in the email. This is going to automatically connect all the providers with an agent, and it's going to connect them to their self-service options so that they have those resources just top of inbox and easy to access. If and when they are having a challenging issue, if they need some further support, we are going to be opening up some one-to-one support calls that we can schedule ahead of time with those providers to really get them connected to a technician on our team who can help walk them through the application and just make sure that they have everything they need. We're really hoping that we can get everything solved through the help desk, but there are always a couple of questions that are going to be needing special attention. So that's an overview of what the opportunities are for help. I believe this resource will also be in the Google Drive resource packet. So if you'd like to reference this again, that's going to live in Google Drive as well. Okay, let me just check I didn't miss anything, but I think that was most of what I wanted to walk through. So I can turn it over to Lindley to facilitate a little bit about, Multisite. Yes, okay. I will just say a quick word. I think we're still working out a little bit. There should be a communication going out either tonight or tomorrow for Multisite providers. I know there are some of you maybe who are on this call or who are aware of multi-site providers with many locations. They will receive one link per location tomorrow. because this is tied to license number, if they have 20 sites that they manage, they will very likely get 20 individual emails from us. We're aware this is overwhelming and might create some issues for our multi-site managers. And so we're working on a process right now where we might be able to do sort of a bulk application process for those people. So stay tuned for more information about that. Do not panic if your providers receive 20 emails tomorrow. I know it's overwhelming, but it's fortunately or unfortunately just how we're doing the application. It's really tied to that site location. So Paige, Lexi, do you guys want to jump in at all? Anything else you want to say before we dive into the Q&A?
No, you did a great job. Thanks,
Thank you.
Megan.
Thank you.
All right, thank you guys so much. So there's lots of questions coming into the question and answer box and also the chat. So my colleagues are hopping in and answering a lot of those questions. I'm going to do my best to actually read out the question and answer, both to facilitate for we've got folks on the phone on the webinar, as well as just to make sure it's accessible for everyone to hear that answer, and then also for the purposes of the recording. So I'm going to start with a few that have already been answered, and then I can hop into some that have not been answered via the question and answer box as well. So if a program was open in March 2020, but was bought out this year, so it had a change in governing body, are they still able to qualify for the funds? And the answer to that question is yes, so long as they were open and operating as of March 2021. And then Debbie just qualified or clarified that they would need to submit that change of governing body application to Child Care Licensing in order to receive the pending license number and have the original inspection license. So Debbie, is there anything else you want to clarify on that?
No, thank you. I appreciate it.
Mm-hmm. We had a question come in about if everyone has to accept CCAP to receive funds. So licensed programs do not have to accept CCAP to get the funding. That is only for those licensed exempt providers or CCAP qualified exempt providers. I apologize. Amber had asked if the link will be the same the whole way through. So yes, that one link that providers get in that initial email, that is going to be the same link that they will always use to apply. We had a question on if a program is open 9 months out of the year and closed for 2 or 3 months during the summer, are they still able to get funding? So providers that are temporarily closed may still apply. And then clarifying that temporary closure, that is one where your staff is still on payroll, your license is still active, and you plan to reopen to in-person care. Temporary closures of physical care due to COVID-19 related safety measures and financial hardships are permitted. Team, is there anything else? I know this has been a tricky one. Is there anything else we want to say regarding temporary closures and how that impacts eligibility?
I think you covered it, Lindley. I think the big thing, and Grace, please jump in, is yeah, making sure that the payroll is still happening. People are still getting paid. You still have your location, you still have your license, and you plan to reopen.
I just wanted to ask Lisa if there's anything we want to clarify on that one. I think the question was specific to summer closures for school-age childcare, and so whether that qualifies as temporary since it wouldn't be COVID or financial hardship.
Yeah, the federal guidance that there was an FAQ that the feds put out on whether providers were eligible, and it specifically says that closure during the school year or during the summer, depending, is not a temporary closure for COVID-19 reasons. So a provider would not be eligible to apply, stating that they were open if they are closed because of either the school year or the summer. The guidance did say that that providers would be able to apply when they are open, so they would need to delay application. We are working with the feds to get some information on sort of how to handle that shortened window. And so we will have information on that as soon as we are able to get some more information from the feds. But right now, summer providers that are only open in the summer would not be able to apply because they are not currently open or temporarily closed.
And maybe to further clarify, school age that are open currently, but will close in the summer are able to apply now because they are open and providing childcare. And we can add additional responses to our question and answer document on this one. We know it's a bit complicated.
Great, thank you, Grace. Thank you, Lisa. A question came in about centers or providers that are in the middle of their Colorado Shines rating process and how they should handle that. So if a center or provider is in the middle of a rating process and they anticipate a higher rating, they can wait to apply to be able to get that higher funding amount. They just will have to balance that between waiting to get funds versus getting a higher amount of funds once that rating process is complete. It will be the rating at the time of application that will be used to determine funding amounts. Karen or anyone else, is there anything you'd like to add to that? All right. There was a question that came in regarding folks that are license exempt. So they're not licensed, but they're also not CCAP qualified exempt. So they're operating legally without a license. If they were providing that exempt care, but they weren't part of that CCAP qualified exempt program, and they're working towards getting licensed, can they apply? So long, this gets tricky too. So I'll probably open this up to the team to kind of help support this answer. But so long as someone was serving as a childcare provider on March 11th, 2021, so either licensed, CCAP exempt, or license exempt, they can receive funding, but they need to be licensed before they can start getting that funding. Anything else the team wants to add to that one? Good. Okay. There was a question about support for our providers who are impacted by the recent fires in Colorado. And Debbie just let us know that these programs are still eligible and we're working individually with these programs on emergency waivers so they can still receive the funds. Question regarding amounts and if they're based on enrollment or licensed capacity, and they're based on licensed capacity. Amber had a question on if the site director and the financial person is one and the same on that application page, can they just leave that information blank where we ask for, who they'd like financial information to go to, and those fields are optional, so they don't need to be answered.
Yep, that's correct, Lindley. Those fields are optional. So if you would like to add an additional financial person in addition to your site director, you can do that, but you do not have.
A question from Sarah Jane, just making sure that providers are clear that they may have already had to provide a W-9 to the state for other programs, like being a CCAP provider. They will still need to provide this information as part of this application. So as you're working with providers, make sure that they're aware of that. That can also be covered on the informational webinars that we're doing. So be sure to drive them to those. Kelly had asked if it is possible for partners to have access to a sample account, so you could do a demo like we're doing now. Lexi noted that there's a sample application on the site. Anything else, Metrix team, you want to add in about that or support resources?
I would just say because the application is tied to the license numbers, I don't really have the ability to create a dummy account for everyone. But what I would say is that and I meant to mention this earlier, actually, so this is a good thing to bring up. The draft questions that are currently in the provider Google Doc drive are actually a little bit of an outdated version of the application. So as soon as possible, if not tomorrow, then over the weekend, I'm going to be updating that document so that it reflects the final version of the application. And for those folks who want to do like a test run or a dry run, I would say that they should use the paper PDF version of the application so that they can review those questions in advance and make sure that they have all the information that they need in order to complete the application. So check back. I would say check back in the Google Drive on Monday, and I should have an updated version of those questions for those providers to be able to review for the application.
Heather asked if Head Start programs and school districts are eligible, and yes, they are, so long as they meet all the other eligibility requirements that we've been talking about. Clarifying if providers will receive an email when they need to report and do those attestations. And yes, Metrics team, that will come from you, correct? All those attestation forms and information.
Yep.
Great. Another clarifying question on just that Colorado Shines rating and what happens if that changes over the 9-month payment period. And that Colorado Shines rating at the time of application is the one that will be used to determine grant amounts. Stacy asked about the expected turnaround time on help tickets, and the Metrics team is hoping to have a 48-hour turnaround on those. Metrics team, is there anything else you want to share on support timelines and that kind of thing?
I mean, that's our guesstimate right now. Obviously, this is all new. We're going to kind of see what the volume is from tomorrow and over the weekend. Me and my team are actually going to be, manning those tickets. So we'll have a better idea, but that's really our goal. And I think that's a pretty, I think it's a good estimate for right now, for sure. Yeah.
All right. There was some concern about the limited times on those support sessions for providers. Megan, do you want to speak any more to that and what you've all tried to make available?
Yeah, absolutely. So this is really, again, just kind of going back to, we're not quite sure what volume to expect. So what I've done right now is schedule one webinar per day from now through early February. They're offered at really variable times. So some are at 7 a.m., some are at 7 p.m., some are at 2 p.m. I was really trying to give a lot of different options for the providers. I realize it might look limited, but we really keep clicking through those days and look at those times. There are quite a few webinars available. I would say that, if and when we start to see a high volume of signups for those webinars, we're certainly willing and ready to add additional dates. But we kind of wanted to see sort of what the interest level was in those webinars before we add a ton. So I apologize if it looks limited, but like I said, there are quite a few opportunities. And so I hope you'll be able to find a time that works for you.
Great. There was also a question regarding if your capacity changes during that 9-month period where you're getting grant payments. And just like Colorado Shines rating, it's the capacity that a provider has at the time of application that will be used to determine payments, and that will stay the same throughout those 9 months. Let's see. I know that there was a question that asked us to kind of restate that information regarding if a program has changed ownership. Either Metrics or someone on the licensing team, can you kind of restate that information?
Hi, sorry about that. Yes, so again, this is kind of a case-by-case basis, and we need to do some research on the licensing side, but we really need to clarify that there was no break-in service, that the families still receive consistent child care. And so we would need a lot of information to make this determination. The new facility would need to have their own license, or we would need to know if they were operating for some reason under the other licensed provider license number, which there are certain circumstances where that is allowed, but typically you would need to fill out a change of governing body application to get a new license and go through that original process. Not sure if there was additional questions on that, Lindley.
I'll hop over to the questions that haven't been answered yet and check, but I think that's good for now.
Okay.
There was a question regarding license type, and does that matter? So is this program for preschool providers as well as childcare providers? And Lisa clarified that licensed preschools and school age providers are eligible to apply for the program. Randy asked if providers will need to upload their W-9 and ACH forms, and they do not. They'll just need to complete the fields in the application for now. Megan, you mentioned we may ask for, oops, and I just lost the question because a bunch came in. You may ask for that later. Do you want to clarify anything on that?
I can clarify that. So if, for example, we go to enter their banking info into the system and it rejects it because it's incorrect, we would ask them at that time to submit to us an actual ACH form. Similarly, if we go to file their 1099 at the end of the year and the IRS says the information is incorrect, we would request an updated W-9 form from them at that time too.
Great. Amanda asked in the chat how long we expect funds to be available, and I saw Grace just answered. So providers can apply anytime between tomorrow and September 30th, 2023. The applications are rolling.
Just to clarify, the application is rolling from tomorrow through September 30th, 2022, but providers will have through September 2023 use the funds, and the funds can also be used to cover past expenses. So back, through the start of the pandemic.
Grace, you actually broke up a little bit answering that. Could you state that one more time just to make sure everyone heard?
Sure, sorry about that. So these funds, the application is rolling from tomorrow through September 30th, 2022. And then the funds will be available for providers to use through September 30th, 2023. And they can also be used to cover prior expenses through the start of the pandemic.
Great, thank you, Grace. I got a note from my colleagues that I may have garbled an answer a little bit. So I want to make sure and clarify to make sure folks understand, and please, someone from licensing, just interrupt me if you feel like I'm doing a poor job explaining. So the question that they were flagging for me was related to this issue of CCAP exempt providers, as well as providers who are not licensed and not CCAP exempt. So CCAP exempt providers can apply for the grant programs right away. They qualify, they're good to go. Team, if a CCAP qualified exempt provider became licensed during that 9-month period, would anything change regarding their grants?
They could apply. If they became licensed, they would be eligible for that whatever the license grant, the grant for the license, becoming licensed would be.
But if they had already applied as a CCAP exempt provider, would that monthly payment they were getting change if they became licensed?
Yes.
So I think to clarify what Michelle was saying is when a CCAP qualified exempt provider becomes licensed, they are eligible to receive a one-time licensing bonus incentive of $5,000. So if they went through that process, they would be eligible for that award. I believe this would fall into the category of they are at the time of their application is what we would use for their licensing status. So if they apply as a CCAP qualified exempt, that's what they would remain, similar to their quality level at time of application. However, they could, since the application is rolling until September 30th, 2023, they could go through that licensing process first, receive that one-time bonus, and then come in at a higher level for that monthly payment.
Okay. I'm noting some questions in the chat about program, like school age programs that are only open now, but not in the summer, or programs that are summer programs, but they're not open now. And I know this is really complex. So we try to restate that one, and then we can definitely follow up with more information as well.
Sure, so I can answer this one, and I'll try to answer it maybe more clearly this time. So a provider that's only open the summer would not be able to apply right now. They would only be able to apply once they are open. We are in the process of consulting with our federal partners on how the award may be adjusted for providers who are only open for a portion of the year. We don't have those answers yet, so we will provide that additional information when we receive it.
Thank you, Lisa. There was a question that came in around programs that are on probation, and Debbie clarified that programs that are on probation are eligible and can apply now. Let's see.
Can I call it this question about links, Lindley? I just want to make sure that Paige's answer gets heard by everybody. So, so someone asked if a provider does not receive their link, what do they do? We have an email address for everyone at every program except for, I believe, 3 or 4. So we have an email contact for everyone. We recognize that that may or may not be the person who's expected to complete the application. So we're really doing our best here. So what I would say is, if they've really talked to everyone in their organization and they cannot figure out who received the link, then they should go to the help desk, the help.coecstimulus.com, and they should complete a ticket. And they can choose technical issue in the application. And then the subcategory would be, I did not receive a link. So what we'll be able to do on our end is see who in the organization or which email address did receive that link. And if we need to generate them a new one, we can do that. The email address is, yes, and just to answer Kelly's question that just came in, the email address is coming from the OEC and licensing database. So that was either the director email or their primary contact in the provider portal. I want to make sure I'm getting that right, Lisa. So, but it should be their primary contact from OEC. If not their primary contact, then it's their director.
Great. There was a question that came in wondering about that deadline of September 30th, 2023, when all of the funds must be spent by. And there is not flexibility to that. That is part of the federal requirements. Lauren or Grace, anything else you wanted to say about that one? Good. I want to return to that question I mentioned. I garbled a little bit. So we kind of covered that question regarding the CCAP qualified exempt providers. So the other piece of that is providers who are currently exempt from licensing. So they're caring for fewer children than licensing requires, and they're not licensed, and that's how they're operating right now. If they were operating in that way, and Grace, remind me the date, the March date.
11th, 2021.
Thank you. So if they were operating in that way on March 11th, 2021, and then they would like to become licensed and they get licensed, they can apply for these funds. Grace or anyone else, is there anything else you'd like to say to help clarify and make that more understandable?
I don't think so. I'm forgetting what the original question was. So if you don't mind repeating that, and then I can think on it again.
Yeah, there was a little bit of concern, I think, a confusion around what is the rules if you're a CCAP qualified exempt provider, what are the rules if you're just a licensed exempt provider who becomes licensed, and then what are the rules if you're already a licensed provider, and all these dates. I think just seeking some clarification around all of that.
That makes sense. So I'll note that we're in the process of creating a flow chart, and we'll post it to our resources page, so you all can have that available as you're supporting providers to kind of walk through what that looks like right now. If a provider was in operation, so as a child care program on or before March 11th, 2021, and they were either already licensed, already CCAP qualified exempt, then they're eligible for the stabilization grant. If they were not already licensed or CCAP qualified exempt, but they became, eligible through licensing or CCAP qualified exempt, then they would become eligible for the stabilization grant. But we know it's a lot to kind of keep track of the dates and the names, so we'll share that resource with you all so you have it handy as well.
Great, thank you, Grace. And Ingrid had popped into the chat. What happens if someone becomes qualified, CCAP qualified exempt? And sorry, Grace, if you had looped that into your answer.
So if a person was, again, in operation as a child care program on or before March 11, 2021, as a licensed exempt provider, and they became qualified exempt, they would then be eligible to receive the Child Care Stabilization Grants. If they, we also have the licensing bonus incentive, and that's available if a provider becomes either qualified exempt or fully licensed after October 1st of 2021, which was when we announced these initiatives.
Thank you, Grace. Heather asked if providers need to keep expense documentation for audit purposes. And Lisa, you mentioned, yes, they will need to maintain records that demonstrate their expenses, and that we will provide some guidance documents to providers on what kind of documentation they need to maintain. Lisa or anyone else, anything additional you'd like to say on that?
I think the only other thing I think that I didn't answer was just the question about the audit piece of it. We don't anticipate that like all providers will be audited, but our audit division is planning on some sort of spot monitoring and auditing to make sure that the funds are going to where they're supposed to be going to, and that they're being used appropriately. So it is something that the providers, as one of the certifications in order to receive funds, have to agree that they will, that they understand that they may have to provide documentation for audit purposes.
Thank you. Dawn had asked for programs on probation, would their quality rating be what it was prior to probation, or is it lower? And Karen, you mentioned generally programs retain their rating level during probation unless otherwise stated in their probation conditions. Licensing, Karen, anyone else, anything additional you'd like to add to that?
No, I'm just keeping in mind that at the time of application, if they are on probation and they had a level 3, then that would be the rating that would follow their application.
Had a question come in regarding what kind of documentation would be needed to show that half of the grant was used to help families with tuition costs. Grace noted that providers will be asked to self-report the total financial relief that was passed along to families. Providers will not be penalized if they're unable to meet that target of providing relief to families. Grace, anything else you want to say on that?
I think that covers it. In our application guide, we do note a variety of options for what financial relief to families means. So we encourage you to look there and have your providers look there. So it includes tuition relief, but also waiving fees, providing relief to overdue expenses. So a number of options to support families with these funds.
Question on, is there a timeline for school district preschool sites to complete a bulk application for all programs? Paige, I know you answered in the chat. Do you want to speak to that at all?
Yeah, so we're currently working on an email to go out to those multi-site or school district providers either this evening or early tomorrow. That process we still have to define and implement. So we're expecting that we'll launch that late February. which obviously would exclude them from this initial payment group. So that email will also include kind of those considerations for them about how that would change their timeline if they choose to wait for that bulk process.
We had a question on if there's any way a program could lose funding or become ineligible. For example, if they provided misleading statements or documentation to acquire funds. Lisa, do you want to address that one? You added it in the chat too, but I wondered if you wanted to say that out loud.
Sure. Let me just open up what I said because that'll help guide me. Okay, well, I can't find it, so I'll just try to remember. So what I wrote was that yes, and this is part of what programs have to certify, that if they did provide fraudulent information to obtain grant funds, maybe by saying that they are operating when they are not, that it's a temporary closure when it's not, things like that, that the state would, and those things are determined, the state would recover funds. Additionally, programs will have to certify each month as part of that attestation process that they continue to be eligible for grant funding. So if a program closes during the course of their, like permanently closes or their license is revoked during the course of their grant, they will not be eligible for the ongoing payments anymore. So if they were to permanently close after 3 months, then they would not receive the last 6 payments. So I think that's all.
Okay. There was a question about where to go for information about allowable uses. So in that provider resource folder that Julia has been dropping into the chat, there's documentation about the allowable uses. If a program has individualized questions, that help desk line or that help desk website that we've been popping in the chat would be the place for those questions. We had a question on for programs that become licensed and get the one-time $5,000 bonus. Do they have to fill in an application? Let's see, Grace, I'm skimming your answer quick. Programs that were in operation on March 11th, 2021, but were unlicensed on that date that the stimulus activities are publicly announced should apply to be licensed through the existing license application process to receive that one-time bonus. Grace, anything else you want to say about that?
Once they go through the normal licensing process, they'll just have to provide some additional information for that one-time bonus. And then they also will be eligible to apply for the Child Care Stabilization Grants. I included the link as well for the provider to start the licensing process.
Great, thank you. There is a question about if home providers are eligible for this. And yes, family child care home providers, if they are licensed or if they are CCAP qualified exempt, are eligible to receive the funding. Let's see. Can we provide any more information? Maybe this is a question for the Metrix team on the reporting, like what those attestation questions will be and kind of what that will look like.
Yes, at some point in the next month, we're still working on finalizing what each of those will look like. And then we'll be able to provide both an overview of what each month will be and give providers a heads up of what they can expect for their following month as they move through the process. So thanks for your patience as we work to figure that out.
I think maybe the one thing that you all should know now, and we mentioned this a little earlier, is that all of those monthly reporting requirements will be housed within one portal that is called MetrixEnroll. And so that's going to be where they go to actually complete those reports. So you can know that at least they won't be getting like this email link to an application every month. We're going to have a single location where they can go to complete those attestations.
We had a question come in around having to pay payments back. And Megan, you had clarified that these are grants, not loans, but I was wondering if potentially that question was in response to Lisa, your answer regarding if a provider could lose eligibility. You're muted, Lisa.
So I think the only reason that a provider would have to pay back funds would be if they misrepresented their information in order to obtain funding through fraudulent means, basically. Then the state would recover funds. If a provider stops being eligible, they would not have to pay back the funds that they received. They would just stop receiving payments.
Great. There was a question that had come into the chat that we hadn't been able to answer yet. So the question is there an appeal process for providers who had a license number issued by March 11th, but were not open for business because they were a new site waiting for licensing to approve to open? Is there an appeal process for providers who are in that situation? And it looks like what we will do is we'll handle those appeals on a case-by-case basis. Grace or licensing, anything else you'd like to say on that?
I'd say that our overall goal is to provide eligible providers with this support and to make sure that these funds are getting out to our providers. And so we certainly want to work with providers, but just need to address these unique situations on a case-by-case basis.
And I guess my question is, do we have kind of a mechanism set up for that? So would they do a help desk ticket through Metrix, or how would they communicate that to us?
A help desk ticket, yes.
Okay, thank you.
We had a question come in about the bonus amounts for infant and toddler care, after hour care, those categories. And if we could speak a little bit about that. Lauren noted that we are currently in the process of determining how bonus payments for serving particular populations will be awarded, and we'll share that information when we finalize the details. Lauren, anything else you want to add on that?
All I'll add is that we are considering issuing those bonus amounts in the form of a 10th payment, although we still are trying to figure out some of those details. That's the current working approach at this point.
Great. Amber had asked in the chat when we'll have some of these additional guidance documents that we're talking about ready. So we'll have the guidance documentation, we'll have the guidance on documentation requirements available by the time providers receive a first payment on February 11th. Metrix team or OEC, any other incoming documents that you want to clarify when we'll have those available? Okay. I am scanning my questions for things that are still left unanswered. If anyone from the team wants to hop in with anything while I quickly do that, please go ahead.
I can go with a question. If programs currently don't charge any tuition to any family, will they be able to document that and use the funding in other areas? And the answer is yes, that we do consider existing financial relief to families as a component of passing along the grant award to families. So existing tuition reductions would count in that area, as well as avoided tuition increases by having this grant.
Amanda clarified her question regarding if a program would have to pay money back. So her question was, if a center is closed permanently or its license is revoked, would they have to repay back the money that was already received? And sorry, Lisa, if you had kind of addressed that in your answer.
That's okay. If a center closes, if a center closes or has their license revoked during the grant period, they would not need to pay back funds that they already received, but they would stop receiving payments once that closure occurs or the revocation occurs. The only time a provider would have to pay back money is if they misrepresented their information in order to get funds. So if a provider was closed permanently or, you know, not temporarily and misrepresented themselves by saying that they were open, then they may need to pay back funds, since that would be considered fraud.
Thank you. All right, as I am scanning, I am running out of questions that are still open. So team, is there anything that you're seeing that you've answered that I've missed?
Or if anybody wants to raise a hand and
Yeah, if you have something outstanding, go ahead and raise your hand. I can take you off mute. All right, so like I mentioned in the beginning, the questions that are general, broad, apply to lots of different programs. We'll be adding those to a question and answer document that we will be putting together, and we'll make sure to provide that to you as soon as it's available. We were recording this presentation, so we'll be sure to share that with you so you have the record of the presentation, and you're welcome to share that with folks if you'd like to. We'll give you the slides, and we'll make sure that you have all those links again to the resources that we've provided. If you have really specific questions about a really specific program or unique situation, again, we would definitely encourage you to go through the route of submitting a help desk ticket. That's kind of the easiest way to get those really specific questions answered. Anything else, team, that I've missed?
Just a big thank you to Lindley for running the show today, and our Metrix team as well.
Happy to help. Really glad to see so many partner organizations on this call. I really think you guys are going to be a huge, huge help to us in this process. So thank you so much for joining us and being a part of the conversation.
All right, thank you so much, everyone.
Thanks, everyone.
Bye, thank you.
Bye.